If you're enjoying this MedPrep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called MedPrep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
I had that dream again. My small business needs to hire, but I don't use LinkedIn, and I hire wrong. So then I'm doing IT, and when I go to plug the servers in, they become sentient, and they won't let us access our network unless we forward their chain emails and memes to more and more and more people, and then I wake up.
Don't let hiring nightmares ruin your dreams. LinkedIn Jobs' new AI assistant finds and invites best-fit candidates to apply, so you can discover talent you may have missed. Post your job for free at linkedin.com/quality. Start hiring today with LinkedIn.
Every Who down in Who Newville liked the holidays a ton. But where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one Who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
This is Dr. Ted O'Connell with the MedPrep to Go Step 1 QBank podcast. Today we'll be reviewing 3 pathology questions. Just a reminder that you can find these questions and many more on our website at medprep2go.com. If you would like to get involved in this project or have any feedback, please contact me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe to the podcast, give us a review, and let your friends know about this question bank. All right, let's go ahead and get started with the first question. A 2-day-old infant is evaluated in the newborn nursery for bilious vomiting, which began at 24 hours of life, and failure to pass meconium since birth. Delivery occurred at term via spontaneous vaginal delivery. The pregnancy was uneventful, but prenatal screening showed low alpha-fetoprotein levels. Vital signs are temperature 36.5 degrees Celsius or 97.7 degrees Fahrenheit, heart rate 96 beats per minute, respirations 35 per minute, and blood pressure 64/41 millimeters of mercury. Physical examination reveals a distended abdomen and diminished bowel sounds. Laboratory studies are unremarkable. An abdominal radiograph shows a double bubble sign. Which of the following is the most likely diagnosis? A. Duodenal atresia. B. Hirschsprung disease. C. Malrotation with volvulus. D. Meconium ileus, or E. Pyloric stenosis. The correct answer is A. Duodenal atresia. Duodenal atresia is a congenital condition that occurs due to the failure of the duodenum to canalize during embryonic development, leading to obstruction. The double bubble sign on an abdominal radiograph is characteristic of duodenal atresia, and the presence of bilious vomiting and failure to pass meconium further supports this diagnosis. Duodenal atresia is present in 2.5% of neonates with Down syndrome. Answer choice B, Hirschsprung disease, is incorrect. Hirschsprung disease presents with delayed passage of meconium and abdominal distension. Radiographs typically show a dilated colon with a transition zone rather than a double bubble sign. Answer choice C, malrotation with volvulus, is incorrect. Malrotation with volvulus can present with bilious vomiting and abdominal distension, but radiographs often show multiple dilated loops of bowel and air fluid levels, not the double bubble sign. Answer choice D, meconium ileus, is incorrect. Meconium ileus is often seen in infants with cystic fibrosis, presenting with failure to pass meconium and abdominal distension. This condition requires manual rectal removal of fecal matter. Answer choice E, pyloric stenosis, is incorrect. Pyloric stenosis typically presents with non-bilious projectile vomiting in infants around 3 to 6 weeks of age. Plain radiographs may show a dilated stomach, but ultrasound is the preferred imaging modality as it allows direct visualization of the pyloric muscle and canal. The key learning point here: duodenal atresia presents with bilious vomiting and abdominal distension in a neonate and is associated with Down syndrome. Abdominal radiographs demonstrate a double bubble sign representing a dilated stomach and proximal duodenum with no distal gas. Question 2. A 6-year-old boy is brought to the emergency department by his parents due to a sudden onset of high fever, vomiting, lethargy, and purpuric rash over the past 12 hours. He has no significant past medical history and does not take any medications. Vital signs show a temperature of 39.5 degrees Celsius or 103.1 degrees Fahrenheit, blood pressure of 70 over 40 millimeters of mercury, heart rate of 150 beats per minute, and respirations of 30 per minute. On physical examination, the patient appears critically ill. There are multiple petechiae and purpuric lesions noted on his extremities and trunk. Laboratory tests reveal the following: white blood cell count, 18,000 per cubic millimeter, hemoglobin, 10 grams per deciliter, platelets, 30,000 per cubic millimeter, sodium, 125 milliequivalents per liter, potassium, 6.0 milliequivalents per liter, glucose, 50 milligrams per deciliter, creatinine, 1.2 milligrams per deciliter. Given the clinical presentation and laboratory findings, which of the following is the most likely diagnosis? A, acute lymphoblastic leukemia, or ALL. B, disseminated intravascular coagulation, or DIC. C, hemolytic uremic syndrome, or HUS. D, meningococcemia with adrenal insufficiency. Or E, Rocky Mountain spotted fever. The correct answer is D, meningococcemia with adrenal insufficiency. The patient's presentation of high fever, vomiting, lethargy, purpuric rash, and hypotension suggests a severe systemic infection. The combination of shock, purpura, and laboratory findings such as low sodium, high potassium, and hypoglycemia points to adrenal insufficiency. Waterhouse-Friderichsen syndrome is most commonly caused by sepsis due to Neisseria meningitidis, leading to adrenal hemorrhage and acute adrenal insufficiency. Answer choice A, acute lymphoblastic leukemia, is incorrect. ALL typically presents within this age group, 0 to 15 years of age, with fatigue, pallor, petechiae, and infections, but does not typically cause acute adrenal insufficiency and shock with a purpuric rash. Answer choice B, disseminated intravascular coagulation, is incorrect. DIC can present with purpura and bleeding from multiple sites, but does not present with the constellation of findings described in this vignette. Answer choice C, hemolytic uremic syndrome, is incorrect. HUS typically presents with the triad of hemolytic anemia, thrombocytopenia, and acute kidney injury, often following a diarrheal illness, specifically E. coli O157H7. Answer choice E, Rocky Mountain spotted fever, is incorrect. Rocky Mountain spotted fever can cause fever and rash, but the rash usually starts on the wrists and ankles and spreads centrally with a history of outdoor activity such as summer camp. The key learning point here, Waterhouse-Friderichsen syndrome results from hemorrhage into the adrenal glands with resulting adrenal insufficiency, usually as a result of severe bacterial infection, most commonly meningococcal septicemia. In addition to hypotension, look for the laboratory indicators of adrenal insufficiency, including low sodium, high potassium, and hypoglycemia.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Here's my 30-second story with Guinness. As soon as my sister and I get home for the holidays, we don't even unpack. We head straight to our pub. The bartender already knows our order, Guinness and fries. We laugh all night, catch up with old friends, and walk home with faces sore from smiling. It's one of my favorite nights of the year. That was my 30-second story with Guinness.
Guinness Draft Stout. Please enjoy responsibly. Imported by Diageo Beer Company, USA, New York, New York.
Question 3. A 24-year-old woman presents to the clinic with a 2-week history of fatigue, weight loss, diarrhea, and palpitations. She denies any history of recent infections. Her past medical history includes systemic lupus erythematosus. She does not currently take any medications. She does not drink alcohol or take illicit drugs. She occasionally smokes cigarettes. There's a family history of thyroid issues on her mother's side. Her vital signs are temperature, 37.1 degrees Celsius, or 98.6 degrees Fahrenheit, blood pressure of 118 over 72 millimeters of mercury, pulse 112 beats per minute, and respirations 18 per minute. On physical examination, she has a fine tremor of the hands and warm, moist skin. On palpation, her thyroid gland is diffusely enlarged, but not tender to touch. Laboratory tests show elevated free T4 and suppressed thyroid stimulating hormone, or TSH, levels. A radioactive iodine uptake scan shows diffuse increased uptake. Which of the following is the most likely underlying mechanism of her condition? A. Autoantibodies to the TSH receptor. B. Destruction of thyroid follicles. C. Excessive iodine intake. D. Mutation in the TSH receptor gene. Or E. Pituitary adenoma secreting TSH. The correct answer is A. Autoantibodies to the TSH receptor. The patient presents with symptoms of hyperthyroidism, confirmed by elevated free T4 and suppressed TSH levels. Her history of lupus raises the suspicion of another autoimmune disease. Additionally, the lack of tenderness on palpation of the thyroid gland, her young age, and gender further support this suspicion. The diffuse increased uptake on the radioactive iodine uptake scan is characteristic of Graves' disease, an autoimmune disorder where autoantibodies, that is, thyroid-stimulating immunoglobulins, target the TSH receptor. This leads to negative feedback suppressing TSH due to overproduction of T4. Answer choice B, destruction of thyroid follicles, is incorrect. This would likely result in congenital hypothyroidism or hyperthyroidism, depending on the nature of the mutation, but it is less common and not typically associated with the presentation of diffuse increased radioactive iodine uptake and the specific clinical features described. Answer choice C, excessive iodine intake, is incorrect. Excessive iodine intake is associated with a higher prevalence of Hashimoto's thyroiditis or subacute thyroiditis. However, excessive iodine intake is a potential precipitating factor but not the mechanism underlying Hashimoto's thyroiditis. Hashimoto's thyroiditis leads to hypothyroidism, except when a transient hyperthyroidism is present. High iodine-containing medications, such as amiodarone, also can precipitate autoimmune thyroiditis. Answer choice D, mutation in the TSH receptor gene, is incorrect. This can cause hyperthyroidism, particularly in patients with pre-existing thyroid disease, called the Jod-Basedow phenomenon. But the presentation is less specific for this mechanism. The mechanism develops due to upregulation of sodium iodide cotransporters, resulting in excess reuptake of iodine in the bloodstream. TSH levels are high to stimulate the thyroid gland to make hormone. Answer choice E, pituitary adenoma secreting TSH, is incorrect. This would result in elevated or inappropriately normal TSH levels despite high free T4 levels. The patient's suppressed TSH makes this diagnosis unlikely. The key learning point here: Graves' disease is the most common cause of hyperthyroidism, in which B cells produce immunoglobulin G, or IgG, autoantibodies that stimulate the thyroid's TSH receptors, making this a type 2 hypersensitivity reaction. Okay, so that's it for this episode, but please do check out all of our other episodes, as well as our content at medprep2go.com. Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.